86% versus 41%. These aren't random numbers. They're the scores that separate AI from human doctors in complex medical cases. Surprised? You should be. AI just did something amazing in medicine, beating experienced doctors in a tough diagnostic test. But what does this really mean for healthcare? Let's look at the details and see how this breakthrough could change medicine. The Underdog AI O1 Preview enters the arena. OpenAI's O1 Preview is a surprise contender in the field of medical diagnostics. This AI model came up in the background, but it was about to make a lot of noise. The people who did this study didn't mess around. They chose tough medical cases from the New England Journal of Medicine, the kind that make doctors of all levels crazy. The AI had to solve hard problems one step at a time, just like a real doctor. To make things fair, they gave the AI some new cases it hadn't seen before. These were the only ones it did a little worse on, which showed it could handle new things pretty well. People began to pay attention as the results came in. Dr. Adam Rodman, who helped write the study, was shocked. "As you might expect, people had a hard time," he said. But O1? There was no need to look at the numbers to know how well it did. This AI could figure out what was wrong with sick people, almost as well as top doctors. It might change how we take care of people. Are you ready for the big news? 78.3% of the time, O1 Preview got it right. That's impressive when it comes to life and death situations. There's more, though. We haven't talked about another big player yet, even though O1 Preview was great. Sure, let's see how O1 Preview and GPT-4 do against each other. You won't want to miss the AI battle. David versus Goliath, O1 Preview, takes on GPT-4. GPT-4 has shown that it can do things like write and code. It is now being tested in medical diagnostics, where getting things right can mean the difference between life and death. It's exciting to see the results. Each AI was given a difficult medical case that would be hard for even the best human doctors. They look like they're tied at first, but we begin to see a pattern as we look further. Case after case, O1 Preview beats GPT-4. It's not enough to just get the answers. You also need to show that you really understand the problems. GPT-4 got a score of 0 in a tricky case, which means it completely missed the mark. But O1 Preview got it right on the mark. For our viewers, both O1 Preview and GPT-4 are owned by OpenAI, but they are different in their own unique aspects. With each new case, the difference between the two AIs grows. O1 Preview keeps doing better than GPT-4, especially when conditions are rare or complicated. The final scores are now ready to be shown. In all cases, O1 Preview got it right 88.6% of the time. With 72.9%, GPT-4 also did well. That makes AI a lot better. The success of O1 Preview comes from the way it thinks. It thinks about things in a chain of thought way, like a person would before making a diagnosis. It can handle hard problems better than older AIs because of this. However, O1 Preview is not perfect. It's great at diagnosing problems and suggesting treatments, but it still can't figure out how likely something is to happen. It wasn't much better than older models in this area. This proves that AI can always get better. This fight between AIs shows us what healthcare will be like in the future. As these AIs get better, they might change how we find and treat illnesses. For now, O1 Preview is the best at using AI to help doctors make diagnoses. It's pushing the limits of what we thought AI could do, beyond diagnosis. O1 Preview's medical reasoning prowess. The medical world is buzzing about O1 Preview's ability to think through complicated cases like a seasoned doctor. Its ability to make accurate diagnoses is impressive. Medical reasoning is very important in healthcare. Putting together a patient's history, test results, and symptoms is like putting together a puzzle. This is what makes a great doctor stand out. In order to find out if AI could think like a top doctor, researchers tested O1 Preview's medical reasoning. The R-IDEA scale was used to figure this out. It checks how well a person can find important information, make plans, and come up with ideas. It's like seeing how a doctor thinks about a tough case. Everyone was on edge as they compared O1 Preview to real doctors. Could the AI keep up with the deep thinking that's needed for tough medical cases? The results were great. O1 Preview did more than just keep up. it shone. Like a professional doctor would, it suggested treatment plans. It wasn't just spitting out facts, it was smart use of what they knew. The final scores opened my eyes. In 78 of the 80 tests, O1 Preview got perfect scores on the R-IDEA scale. This means that 97.5% of the time, the AI thought like the smartest people in the world. However, O1 Preview is not perfect. It still has trouble with probabilities, which shows that it can't think about things in a more general way. How did the AI do all around? It did better than expected, showing that it can often think about medical problems as well as or better than doctors. This shows us a possible future in which AI could be a very useful tool in healthcare, helping doctors help their patients even more. The ultimate test, complex management cases. Even though O1 Preview did a great job with standard cases, some doubters were still not convinced. Sure, they replied, but how would it fare against the trickiest, most perplexing medical scenarios? As it turned out, a series of almost impossible cases were about to put both humans and computers to the last test. Medical problems that are hard to solve are like Mount Everest. These aren't normal diagnoses. They're the kind that keep even the most experienced doctors up at night. We're talking about people who have a lot of different conditions that affect each other, rare diseases, and symptoms that don't quite fit any standard description. In these situations, you need more than just knowledge. You also need a level of intuition and problem solving that many people thought was only human. So that O1 Preview could really be pushed to its limits. 25 experts got together to make a challenge that would make even the most experienced doctors sweat. These cases weren't just hard, they were made to be as complicated and confusing as possible on purpose. It was like asking a world-class chess player to solve a puzzle where the rules were always changing. It was clear that these cases were hard for human doctors to handle. Even though they had years of experience, these tough situations made them question their diagnoses and treatment plans. The experts watched as their coworkers struggled with the complexities of each case, missing important details or failing to make connections between symptoms that didn't seem to be related. At the same time, O1 Preview worked through the same cases in the background. As the AI thought through each complicated case, the excitement in the room grew. Could a machine really do better than humans in these incredibly tough situations? As soon as the results came in, they were nothing short of amazing. In case after case, O1 Preview showed that it could put together different pieces of information and make correct diagnoses. It wasn't just giving correct answers. It also showed what it had done by giving complex reasoning that amazed people who saw it. In one especially striking example, there was a rare disease that doctors often missed in humans. While GPT-4 failed to find the key factors, O1 Preview correctly identified the complicated disease. The AI did more than just make the diagnosis. It also came up with a full treatment plan that took into account the patient's entire medical history, as well as any possible side effects. As the challenge went on, a clear pattern started to show itself. Not only was O1 Preview keeping up with the experts, it was consistently doing better. The AI was very good at things that humans usually struggled with because it used structured reasoning and could process a lot of medical information. After all the scores were added up, it was clear that O1 Preview did a great job. It got 86% of these complicated management cases right. Human doctors, on the other hand, got scores between 34 and 41%. There was no denying the gap, and it sent shockwaves through the medical field. Then, what specific medical task did the AI do better than humans? O1 Preview was especially good at diagnosing rare diseases, making connections between symptoms that didn't seem to go together, and coming up with complete treatment plans that took many things into account. It could process and put together a huge amount of medical information, which let it see patterns that people might miss, especially when they are pressed for time. Conclusion: as we've seen, O1 Preview's performance across various medical tasks is nothing short of remarkable. From nailing complex diagnoses to demonstrating human-like reasoning, this AI is pushing the boundaries of what we thought possible in healthcare. But let's not get ahead of ourselves. There are still challenges to overcome. On one hand, O1 Preview could revolutionize medical care. Imagine having an AI assistant that can help doctors tackle even the most puzzling cases, potentially saving lives and reducing errors. It could be especially valuable in areas with limited access to specialists. But there's a flip side to consider. How do we ensure that AI complements rather than replaces human expertise? And what about the ethical implications of relying on AI for life or death decisions? As we look to the future, we need to think carefully about how to integrate AI into healthcare responsibly. We need better evaluation methods, real-world clinical trials, and improved collaboration between AI and human doctors. There's also the challenge of addressing ethical concerns and practical implementation issues. So here's a question to ponder. In a world where AI can outperform human doctors in some areas, how do we strike the right balance between technological advancement and the irreplaceable human touch in healthcare? The answer may shape the future of medicine as we know it.